evening. Thank you for joining us on this special series, Reimagining Public Health for New York City, a wonderful partnership between New York City Department of Health and the Fund for Public Health New York. My name is Helen Arteaga Landaverde, and I'm the proud CEO of New York City Health and Hospital, Elmhurst. As a representative of the public health system that cares for people from extraordinary diverse backgrounds and speaking hundreds of languages, I'm honored to be with you here tonight to discuss this important topic, Indigenous knowledge and values for health equity and justice, a conversation centering on how we can work together for improvement of health equity for our Indigenous community. Before we begin our discussion, I really want to thank Dr. Morse and our beloved Commissioner Dave Chosky for creating the space for this discussion. I'd like also to tell you a little bit about my hospital, which is located in the heart of the borough of Queens, which serves over 1.2 million people in one of the most diverse neighborhoods in the world. Not New York City, not New York State, the world. But what keeps us, one thing is for sure, is our mission. Our mission revolves around one thing: providing high quality care to everyone, regardless of their income, their immigration status, or their ability to pay. We are deeply invested in our patients, their families, and in their communities, no matter where they come from. So closing the health equity gap is crucial and super important for us. We are doing a number of things to close that gap, including one, engaging with our grassroots organizations to promote health literacy, build trust, and increase access to care. We have found that many of our communities have huge still significant barriers to accessing care. This is particularly true for our immigrant brothers and sisters and our first-generation Americans who have limited knowledge of how the healthcare system works here in the U.S. and in New York City. So we have ongoing partnerships with many of our CBOs to help ease these barriers and improve access to care. This has been especially crucial during this time, in this time of the pandemic, as we have worked to vaccinate thousands of adults, adolescents, and children over the age of 12 in our community. Plus, we have worked with our local business owner to get their employees vaccinated. We have even gone door to door, encouraging our community members to get vaccinated and help us fight this pandemic. Our physicians, our nurses, our dietitian, our mental health providers, and other countless healthcare workers are regularly and even daily working with these CBOs to do health fairs, health talks, and other outreach events to improve access to health information, but more importantly, to empower our community members to make informed health decisions. The second thing that we're doing is advocating on issues related to social determinants of health. When we think of healthcare, we often think, what happens to a patient inside our wall, inside our hospital? But what happens to our patients after they leave our hospital? Or what happens before they even get to us? Do they have a safe place to live? Do they have affordable housing? Do they have access to enough food and clothing? Do they have access to a job resource? Can their children get a good education? Do they have the right opportunities for the future and for social mobility? If the answer is no, it could be devastating and even impactful on both physical and mental health. So we see it our job here as Elmhurst and as healthcare providers to advocate not only for access for healthcare, but also access to other things that are necessary for healthcare to live a healthy lifestyle. We do our best to connect our patients to healthy food resources, legal aid services, and housing resources, so these stressors that impact the health can be reduced. For example, we have a farmers market here at Elmhurst that provides freshly, locally grown products to our community members every Tuesday, and many of our patients receive vouchers to shop at the farmers market at a reduced or low cost. We also have and partnered with neighborhood housing services and the legal aid to have these services for our patients within our hospitals. This gives our patients access to housing resources and legal assistance. And three, we're improving language access. As part of our healthcare services that we provide here at the hospital, we provide translation and interpretation services to over 125 different languages, which represents 93 different cultures and religion, including some of our indigenous languages that are spoken by our patients. We are working hard and devoting time and more resources to our language access program. For example, one of the things that we have done is we've implemented video interpretation, which allows our patients to speak directly to an interpreter through video conferencing. This allows a more direct patient engagement with the interpreter, the provider, which at the end leads to a better patient experience. We know We can't close the health equity gap and achieve racial justice in healthcare alone. We must rely on each other. And I know we have a long way to go, but I personally am super excited by having this opportunity tonight and having an open and honest dialogue about the long history of disinvestment in communities of color. The ways we can actively repair that damage is important. And if COVID-19 pandemic has taught us anything, that is that a truly healthy society is where all communities are valued and cared for. So with that being said, let's get started. I would like now to introduce Clifford Matias, founder and director of the Red Hawk Native American Arts Council, who will honor us with a performance to center us for our discussion tonight. Thank you.
Good afternoon. My name is Cliff Matias. I'm the cultural director of the Red Hawk Native American Arts Council. I come to you from Lenapehoking, the homeland of the Canarsie, in Brooklyn, New York. As an indigenous person, Quechua and Taino, I am also a visitor to these lands, but as indigenous people, we have always given acknowledgement to the stewards of the land. It's a very important part of our communication, and I'm so happy to see that this has become a practice amongst non-native organizations and people, and so that brings a great joy to myself and many native leaders throughout the different communities. This program today it's a great honor for me to be part of. We're talking about public health for indigenous people, both North American but also South America as well, and I am quite familiar with the prestigious panelists that will be speaking today, and the great work that they're doing within the indigenous communities. I'm going to play a flute song which really brings us all together through love. You know, that's the original story of the flute, and you know, no matter where you go in indigenous communities, we always talk about the flute being a messenger of love and people coming together through the sounds of this flute. And so I'm going to share some of this love with you, and hopefully it will continue to grow and not in just our communities, but and not just here in New York City, but around the world. Thank you so much, and ladies and gentlemen, Dr. Morse.
Thank you so much. Good evening, everybody. It's really wonderful to be able to open this evening's event, both with Helen Arteaga, as well as Cliff Matias, and with their offering to set up the conversation this evening. It's really exciting to also be kicking off season 2 of Reimagining Public Health. I'd like to remind everyone that closed captioning and translation, a translation line is available throughout the event, and the information is in the chat box or the box
Good afternoon. My name is Cliff Matthias. I'm the Cultural Director of the Red Hawk Native American Arts Council. I come to you from Lenapehoking, the homeland of the Canarsie, in Brooklyn, New York. As an Indigenous person, Quechua and Taino, I am also a visitor to these lands, but as Indigenous people, we have always given acknowledgement to the stewards of the land. It's a very important part of our communication, and I'm so happy to see that this has become a practice amongst non-native organizations and people, and so that brings a great joy to myself and many native leaders throughout the different communities. This program today it's a great honor for me to be part of. We're talking about public health for Indigenous people, both North American but also South America as well. And I am quite familiar with the prestigious panelists that will be speaking today, and the great work that they're doing within the Indigenous communities. I'm going to play a flute song which really brings us all together through love. You know, that's the original story of the flute, and you know, no matter where you go in Indigenous communities, we always talk about the flute being a messenger of love and people coming together through the sounds of this flute. And so I'm going to share some of this love with you, and hopefully it will continue to grow and not in just our communities, but and not just here in New York City, but around the world.
Apologies for the little technical difficulty there, but I'm glad we had a chance to return to Cliff Matthias's words and performance. I want to pick back up where I left off and just highlight again that some of the research that our Division of Epidemiology has done here in the New York City Health Department has shown that for Indigenous communities here in New York City, there have been lower rates of access to healthcare and a higher prevalence of some chronic conditions. But what's important is to know that these differences in access and chronic disease are from all kinds of forms of systemic racism and settler colonialism that have not been interrupted over generations in this country. And this tells us that the public health community itself and our institutions in public health have to do more to make sure that Indigenous peoples and communities are seen and recognized, both when we're doing research and data collection, but even more importantly, in the solutions to the inequities that we uncover when we look at the data for the health of Indigenous communities. In public health, it's also really important that we have specific categories that accurately reflect and identify the communities that are represented across the city. And this includes Indigenous communities who often, unfortunately, have been excluded or sometimes misrepresented or misidentified when we look at data across the health department and healthcare systems. We have to hold ourselves accountable to do better in this realm and really make sure that the visibility and identity of Indigenous communities is appropriately and accurately represented and in a way that respects the beliefs and identity of these communities. We've also been honored to be able to support some of the community-based organizations that are Indigenous-led in this city, and that's just one tiny piece of a much larger puzzle around honoring and respecting Indigenous communities and their rights and priorities. I also want to acknowledge that as a part of the COVID-19 pandemic, the Center for Health Equity and Community Wellness, which is the center that I lead, has been able to also support a more equitable access to translation and also support the Endangered Language Alliance for language services to support 15 community conversations and 12 languages indigenous to Mexico, Guatemala, Honduras, Ecuador, and Peru, which again is a small step in the right direction. We also are continuing to support the Red de Pueblos Transnacionales, which is an organization focused on outreach in Indigenous languages to improve vaccination uptake and other social services in priority neighborhoods that have large communities of Indigenous people. We also, again, have to be clear that Black, Indigenous, and people of color have been demanding justice, fairness, and equity through both protests and demonstrations, but that the institutions in this country and government have to move faster to correct wrongs and to address systems and policies that advance systemic racism and oppression. I believe that we can do a lot better in this realm by directly supporting the work of communities like Indigenous communities in New York City. I think it's also a reminder, this once-in-a-century COVID pandemic, that we can't wait any longer and that we have to continue to organize, connect, and advocate for changes urgently. And this is exactly what we think of when we think about how we can reimagine public health and ensure that health equity is, again, just not just a process, but a goal. And I believe that a lot of the work we're doing at the health department will get us closer to some of those goals. I want to also recognize that the goal of the New York City Health Department is for public health to better serve Indigenous peoples and also listen to Indigenous communities. So again, this evening is a really exciting opportunity, I think, for us to be in dialogue and in conversation, and more than anything, for me in particular, but for the whole public health community, to listen, to be fully present, to be fully immersed, and to learn from the conversation today. This is truly how we can both learn new perspectives and gain new insights and reimagine the future of public health together. So thank you again for joining us for this dialogue and for this conversation. I'm very, very excited to also bring my co-moderator for the evening, Angela Soto, who is the Director of Community Health Promotion at the Health Department in the Division of Disease Control. Angela, please do introduce yourself.
Hi, thank you, Dr. Morse, and thank you, everyone, just here to assist us in whatever is needed, and for this wonderful opportunity to again give voice to our Native American communities living in New York City and throughout the United States, and our Indigenous communities from all over the Americas. Thank you.
Thank you, Angela. I'm honored to get to bring our panelists onto the virtual stage and introduce them. I'm going to begin with introducing one of our 5 panelists, Ben Geboe. Ben is an enrolled member of the Yankton Sioux tribe of South Dakota. Thank you for being with us this evening, Ben. Next up, we have Sutton King, who is co-founder and president of Urban Indigenous Collective. Thanks for being with us, Sutton. Thank you. We have Sheldon Raymore, who's a multidisciplinary artist. Thank you so much for being with us, Sheldon. And we have Zenaida Cantu, who is co-founder of the Council of Indigenous Peoples here in New York City. Thank you so much. And last but certainly not least, we have Yoloxochilt Marcelino Cano, who is an advocate for the rights of Indigenous migrants. Thank you so much for being here with us, Yoloxochilt. And thank you again to all of our panelists. I'm just going to kick us off with a first round of questions. And I'm going to ask each panelist to just share your reflections for a few minutes with us. I have a slightly different question for each of you. All of your work, of course, is just incredible, inspiring, and connected. But I have a slightly kind of different angle on the work and experiences that you have for each of you. And I want to kick us off really with focusing on key learnings and how we can share knowledge and how we can learn from the work that you've been leading. And so the first question, say that again. Oh, the first question is for Sutton King. Sutton, you are in the process of opening a location with the Urban Indigenous Collective, and you've also hosted a series of fireside chats with community leaders and a series of educational events. Can you tell us a little bit more about that work and how you seek to center community when you're thinking about both your work and how we can better center community perspectives in our public health responses? And specifically, if you can talk a little bit about what that means and what that looks like to center communities, and what it looks like to provide culturally appropriate and culturally humble resources.
Great question. First, Poso Segoli, Sutton King, Naktau Pinuki, Nukats Ungwahawe Ni'i, Wagneta Nawagitolota, Oniota Aga Ni'i. So hello, my name is Sutton King. My name is also Naktau Pinuki, which means comes first woman. I'm Afro-Indigenous, and I come from both the Menominee-Oneida nations of Wisconsin. And yeah, I think it's really important that when we're talking about community-led organizations, that organization is informed by community voice. And so for us, the Urban Indigenous Collective, we launched in 2019 with a volunteer-based, student-led group, and we really came into community wanting to center community voice and come into community in a good way. And so in 2019, on Indigenous Peoples Day on Randall's Island, was the first time that we launched within community publicly. And we launched with a community health needs assessment prior to any funding, really to be able to capture community voice and really assess what is important in terms of programming, what is important in terms of healthcare and services. And with that, we were really able to start looking at funding that aligns with the need of community, which is really exciting because with that, we've been able to partner with a number of foundations and organizations to get to this point where we're at now in 2021, where again, we did not know that it would be the last time where we were able to be all together in 2019 before COVID. But coming together again on Randall's Island this year, we were able to launch our community survey that really assesses what a community-based cultural center will look like for our community, and really asking community, what does safe look like, right? If we're trying to build a safe container for community, it's important to understand what that means for community. And what is accessible? That's also important to be able to understand through community surveys what that means. And not only capturing that in a quantitative way, right, through surveys, but also a qualitative way. And so it was really our objective to be able to have a community health forum in 2019 and into 2020. Obviously, with COVID, it was not safe to gather, and we really needed to really understand how we would be able to host that in a digital first way. So we were really excited to be able to host a digital community forum to really be able to, again, better understand what kind of programming our communities are looking for, what kind of resources are considered to be culturally appropriate for them. I think we would be remiss if we looked at data and decided to create programming and write our grants based on that, when we know that data is severely lacking, right? We're not being counted, right? And therefore we're not being accounted for. And so again, being able to have those dialogues and create a safe container so that we're able to understand both from a quantitative perspective and qualitative perspective how we can better show up for our community. And with that, I know you touched on just some of the work we did around our COVID-19 campaigns. And so, you know, wanting to, of course, be on the front lines in a way that can support our community in a sensitive way. We recognize that, as a new organization recently emerging, that we were occupying more of a social media space. And so how could we really show up in that way where our social media platforms were bringing in a lot of urban natives? And so we hosted a series of fireside chats, creating social media campaigns and toolkits, and really recognizing the need to talk about the harms that have been done as it relates to public health and research, and why there is so much hesitancy and fear around vaccinations, and how we can really talk about what's happened, why those fears exist, again, to really create, and I know I've used this word a lot, but a safe container for our community. And I think we would be remiss if we are telling folks what to do without really acknowledging the harm and the fear that's happened for many centuries to Black and Brown bodies as it relates to the Western scientific model. So we're really excited, again, to really make sure that in every step that we grow as a young Indigenous-led public health organization, that we're continuously checking in with our community around consultation to really ensure that our programming and our organization centers community voice every step of the way.
Thank you so much. So beautifully and clearly stated. Thank you for your work, and thank you for describing it so well, especially for really asking the hard question, what does safety mean? And then, it makes me as a person in public health want to ask the question and be more serious about the question, how can we be more trustworthy, right? What do we need to do to be trustworthy institution, rather than sometimes what happens is pointing fingers and blaming communities that have experienced historic and current marginalization and oppression. So I really appreciate that, Sutton. I'm gonna move to the next panelist and ask the next question to Sheldon Raymore. And again, thank you for being with us this evening. It's so refreshing, and it's such an honor to be in dialogue with all of the panelists, particularly because you represent so many different sectors and so many different disciplines and fields. But specifically for you, Sheldon, you are a spoken word performance artist. And you talk about how you tackle subject matters in the contemporary and traditional worlds of Native American lives. So I was hoping you could tell us a little bit about the importance in acknowledging and keeping Native American and Indigenous peoples centered when it comes to discussing history, and how that's important for us to do within public health as well. And Sheldon, I think you might still be on mute. Sorry. Can't hear you just yet. But that's okay. Take your time. We're good. I think it's still not quite there yet, but no worries. It might be the headphones not connecting. Do you want to try again, Sheldon? And if not, we can come back to you. Okay. There's always a little tweak that doesn't go quite right, but that's okay, Sheldon. We're going to come back to you and look forward to asking that question again. I would like to move then to Zenaida for now, and again we'll come back to you, Sheldon, once we can figure out the tweaks on the sound. Zenaida, you work as an interpreter, and you're also an activist for Native communities across the United States. I was hoping that you might be able to talk about some of the unique challenges and some of the inequities that you've seen in health and challenges that you've seen across Indigenous communities in the Americas, as well as in New York City. And I'm going to ask Angela to help me with translation here.
Sí, hola Zenaida, buenas noches. Gracias por estar aquí. La pregunta que quiere hacer la doctora Morse es... reconoce de que usted es intérprete del idioma MEPA y también es activista. La doctora quiere que nos diga en el trabajo que usted desempeña viviendo aquí en la ciudad de Nueva York, la importancia de tener centrado y reconocer las costumbres, la sabiduría, el conocimiento, los valores de la comunidad indígena aquí en la ciudad de Nueva York. Y si puede compartir también las barreras que usted ha experimentado y que la comunidad indígena experimenta o que vive aquí en las Américas y en la ciudad de Nueva York, por favor.
Sí, muchas gracias por la invitación. Muy agradecida de estar aquí presente representando a los pueblos indígenas de Latinoamérica. Y más que nada, quiero comentar un poco de cuáles son mis trabajos aquí como activista. Como activista he participado de diferentes proyectos con el Departamento de Salud, haciendo las encuestas, cuáles son los números de los indígenas o personas latinos aquí en Nueva York. He estado involucrado también en diferentes organizaciones comunitarias sin fines de lucro, en especial lo que es en lingüísticas e idiomas, sobre los intérpretes de los pueblos indígenas que radican aquí en Nueva York. Y también mi trabajo es interpretando diferentes estados, en California, en Arizona, haciendo intérprete de mi lengua MEPA. Y pues es un orgullo, y sí, hay muchos desafíos desde el idioma, desafíos desde lo que es su salud, los trabajos, y entre otras más, hay muchas barreras que enfrentan los pueblos, las personas indígenas aquí en la ciudad de Nueva York.
Dr. Morse, would you like me to translate that, or were you able to capture that in the dialogue box? I could definitely summarize the many challenges and the barriers that are faced by the Indigenous communities. But before I go to the barriers and challenges that Zenaida described, she described a bit about the work that she does, mainly as an interpreter in the language Mepa from the state of Guerrero in Mexico, where she is from, and how she provides this language to other communities that live throughout the United States, like in states like California, and as an activist, voicing mainly the voice that is silenced by living as an Indigenous person in this country. She does know that our Indigenous communities face many challenges, mainly language, but among others is health. So health access or health care in general, and jobs. So the many barriers that she finds throughout the United States, but also living here in New York City. Zenaida, sí, en la traducción hice lo adecuado, y si quiere compartir más. No sé si lo quiere también compartir en MEPA. I'm asking Zenaida if she wants to say this in MEPA as well.
Rina nelo na Swahili na Nueva York gyo. Pumba ari nyahuri godo ikuna kana guari gu shaboti nduyati wa daichun nutanumu nga no tanumu shaboti Swahili katana no waika sho. Ni wa disho na kitimbaria tutsigu. Ni kwa na sho encuesta drigo departamento drigo salud jami manga na gui nga ngu shaboti nda yo ma pro ngari na guanya ona corterina tobitsa ne shaponya ami manga ne manga na ngriga sho no jawasho ono kushisho awasho ri mambanuri injusticia rina no ngona swahili nanawa stigui ki shuge anga sho tsinonya honga que numbarige. Bueno, quiero agregar en español que bueno, entonces Sí, hemos estado todo, más que nada, estamos haciendo abogacía sobre cada proyecto de lo que necesitan a los pueblos o las personas indígenas. Hemos estado haciendo encuestas sobre los números de los indígenas aquí en Nueva York y también nos hemos dialogando, haciendo como abogacías a cada necesidad que están enfrentando aquí en las comunidades y también hemos estado como y haciendo protesta sobre los atropellamientos de los especialmente para los repartidores de comida, entre otros trabajadores domésticas, trabajadores de construcción en diferentes áreas del trabajo que hacen nuestras comunidades indígenas aquí en Nueva York, pues son necesidades grandes, pues eso me necesario de involucrar más hacia los pueblos, a abogar por ellos, dialogándolos con instituciones públicas donde se necesita a escuchar sus voces, sus necesidades de ellos.
Again, I will summarize. I know that there's some part, but I will not do it justice, but I will try. That Zenaida would like to add that part of the work that she also does as an activist is advocacy, advocating for the Indigenous communities that do not have a voice, whether it be to link them to care or to other services. It does require protest to have that voice be heard. So protesting to assure that the silenced voices get a voice. And it includes many of the workers, many of the protests or advocacy is around workers and workers' rights, whether it be food pantry workers, construction workers, day laborers. It's really advocating for those needs. And that is the way that she conducts her activism and representing the silenced.
Thank you so much, Zenaida, and thank you, Angela, also for translation support. I just really want to thank you for speaking so honestly and directly also about the need for advocacy and your work around workers' rights. The public health community, I think, has much to learn from advocacy around worker justice and worker rights, and very, very much appreciate you describing that work so clearly for us. We're going to come back to that conversation in the next round of questions as well. So thank you again to both of you. I'm going to turn the next question to one of our other incredible panelists. This one, excuse me, is for Ben Geboe. And Ben, again, thanks for being with us this evening. You have tremendous experience over many years working with Indigenous community organizations in both rural and urban settings, and have really focused on barriers to Indigenous health services. And you've also advocated a lot for participation amongst Indigenous communities in all levels of healthcare services. So I was hoping you could talk a little bit more about how you do that work and what that looks like. And also just sharing a little bit more about how you would like to see healthcare organizations, as well as public health, how you'd like to see us do better in terms of ensuring access and appropriate services for Native American communities.
Haukola, Benji Boe Michi Apie Tiospe Mitawa He Wakanka Duta. So my name is Ben Geboe, and I'm an enrolled member of the Yankton Sioux tribe, and I come from the Red Lightning family unit. And I'm so honored to be a part of this forum and to see my Indigenous sisters and brothers talk about we're kind of countering that colonial veil of invisibility by coming together. And so thank you so much for hosting this evening. That's part of the work. It's like for every prohibition on our language, on our rights, on our community, the more we come together and do things, we're restoring ourselves and undoing and kind of supporting, this kind of resilience that's much needed, because our Indian communities, American Indian communities, are still languishing when they look at statistics and they talk about poverty or, diabetes, asthma, rates of, injury, um, rates of domestic violence, rates of low educational attainment. Uh, these statistics are drawn from Native American communities throughout the United States. And so it shows a very, stark picture that, American Indians face across the country, and is shocking. In a Western society that's supposed to be number one, we're the last. And a lot of it has to do with our continuing work to, promote our sovereignty. And, it's not a mythical struggle. There are something like 50,000 lawsuits against the United States government for land, rivers, mountains, lakes, spiritual places. So we're very much activated on many different levels. And, the American Indian Community House is diverse. We represent 79 different American Indian communities that are from all over. And we've been heavily impacted, as Sutton had talked about, with COVID. And we're actually hosting a COVID Memorial Evening on Thursday, November 4th, and you're all welcome to join. We're sending tribal leaders commemoration letters saying we're so sorry. And we also had many community members that passed here that we weren't able to come together and sing songs on a drum or observe that. So, for us, the resilience is about asking for not just restorative resources, but visibility. And that's why forums like this are very important. It goes into a record of action, that we're not just sitting there and kind of experiencing this stuff, but we're trying to undo it. And that's important for Indigenous people everywhere, that there's a future of survival. So the other thing we're doing is we're organizing a nurses conference in June with Great Plains Native American Nursing Association here in New York, and we're promoting, this urban rural situation, because some of us come from Native communities in the middle of the country, and we come to this urban setting and we're not counted and things are not for us. And there's a big problem with the identified payer when it comes to health services. That's a barrier that people, you have to apply for Medicaid, and what you got at Indian Health Service will not be replicated here. So, and the institutions are blind to our concerns. They're like, well, no, it doesn't matter what you are back home. Here, you're just, indigent, or you don't have access to resources, insurance, and so we do a lot of referrals, a lot of showing up at hospitals and clinics, fighting for people to get the actual basic care, because they're not on their reservation community where the tribal community will provide through Indian Health Service these different services. So, a lot of referral, a lot of connecting. And I'm always glad to see a diversity of Indigenous communities. There should not be many. There's never one library, one restaurant, there's many of us working on different angles, and I always promote that. So, please.
Thank you so much for that, Ben. And thank you in particular for underlining how colonial history and settler colonialism specifically made invisible and oppressed Indigenous communities, and how some of our work, and certainly in some of how we need to be better in public health, is ensuring that we reverse that invisibility, that we be far more engaged and far more serious about how we can ourselves within public health and healthcare ensure access, so that bridges are not needed, that that access is simple and easy and accessible as always. I want to turn back to Sheldon. I believe we now have Sheldon Raymore able to speak with us. Is our sound okay now? Okay, you might still be muted. Oh man, it might not be our lucky day, Sheldon. For some reason, I still can't hear you. But that's okay. I know we'll figure it out, and we'll come back to you. We'll try again in just a moment. And in the interim, I'm going to turn to one of our other panelists, Yoloxochilt. And Yoloxochilt, thank you again for being with us. And thank you for being able to speak to your work this evening. I'm going to just ask you another question as well. And thank you, Angela, for your help with translation again. So Yoloxochilt, you work as an advocate for the rights of Indigenous migrants in New York City. And you also work as an interpreter, as well as working with the Council of Indigenous Peoples living in New York. So I was wondering if you could share with us a little bit about how you see Indigenous knowledge and values in your work and how it connects to health equity and social justice. So we'd love to have help from Angela in translating, and then look forward to your thoughts on this, Yoloxochilt.
Hola, Yoloxochilt, gracias por estar aquí con nosotros. La doctora Morse quiere hacer la siguiente pregunta. Como activista que aboga por los derechos de los pueblos indígenas que radican aquí en Nueva York, y como intérprete que trabaja con la red de pueblos indígenas en Nueva York, ¿puedes compartir con nosotros la sabiduría, el conocimiento y los valores en tu trabajo y nuestra comunidad indígena para llegar a una equidad en la salud y una justicia social?
Muy buenas noches. Gracias por invitarme a participar en este foro. Es un placer conocer a otros hermanos hablantes de otra lengua. Primeramente enviaré el mensaje en mi lengua Savi y después lo enviaré en español. Cuando na tayo na do kibibiti ka inshay na tayo na kibika tung saan tata kunda bibi ini tu sa ta basa kunda inio sabaichi michikuyo kayo shayo nya kuyo no doctor nya kuyo nya nuka binabali se o sa basa kunda inio miku que tu saba navali se ello raña ha kya kuni dikandi sha andi na tayo kibibiti nya kuchinyu na yo ochinde na mio nya kuchinyu no kisha nya nani información da yo nya tuyo nya no kuchinyu kunda inyo michi kuyo kayo sha derecho yo kuyo kayo sha na tayo nando tundo ora kibika ana nya ha kya donde yo kibibiti. Bueno, principalmente en este año, durante la pandemia y anteriormente, nosotros hemos estado haciendo una abogacía por nuestra gente de manera de salud. Muchas de las veces la información acerca del seguro médico, de dónde poder localizar a las personas para poder tener seguro médico, no les llega la información, qué es lo que necesitan, cómo necesitan llegar hacia esa salud que ellos necesitan. Y muchas de las veces nuestra gente prefiere no ir al hospital y quedarse en casa para poder de alguna manera utilizar la herbolaria que se nos enseña desde nuestra niñez, con nuestros padres, con nuestros abuelos. Por ejemplo, durante la pandemia mucha gente se curó consumiendo té de hierbas, por ejemplo, utilizando ginger, limón, miel, y curarse de esa manera en la casa, porque realmente ellos desconocían que ir al hospital, porque también surge esta duda de que si tú vas al hospital es porque tú tienes que pagar una gran cuenta para poder tener acceso a esto. Muchos de ellos han acudido y eso es lo que ha sucedido. Y pues esta información se divulga en nuestra gente y básicamente eso es lo que sucede y la gente no se acerca para poder tener ese acceso hacia la salud. En otras partes, por ejemplo, nosotros en este momento la abogacía también hacia nuestra gente que no le llega la información porque a veces son discriminados en el trabajo, son discriminados y a veces de alguna manera sometidos a, a esto del miedo de que si ellos llegan a denunciar o llegan a contar algo que está sucediendo en el trabajo, ya sea en trabajo de casa, en el trabajo, por ejemplo, que están haciendo, lavando platos, cocinando, muchas de las veces ellos son sometidos al miedo, a que si tú me acusas, tú vas a ser deportado inmediatamente hacia tu país. Y pues la gente pues lo que hace es no decir y no contar esto porque ellos tienen ese miedo hacia acercarse hacia la justicia, hacia la salud, porque esa es lamentablemente lo que se ha divulgado en estos tiempos. Y uno de nuestro mayor trabajo es poder difundir la información de que sí pueden tener acceso a la salud, de que sí pueden tener derechos, de poder reclamar las horas que no les pagan, de reclamar todo tipo de accidente que sucede en el trabajo, por ejemplo, de que no les enseñan a utilizar de manera correcta lo que son los líquidos para limpieza, porque se pueden intoxicar y toda esta información nosotros con gusto, conforme nos va llegando, nosotros la estamos haciendo hacia nuestra comunidad que llegue en nuestra lengua. Y pues realmente los valores que se tienen en nuestra comunidad, más que nada siempre es respetar las reglas en esta ciudad en la cual todos estamos convergiendo y pues realmente para nosotros es un lugar extraño, respetamos, convivimos con toda la gente, pero muchas de las veces no nos llega, no recibimos no recibimos ese mismo respeto, sino que somos discriminados por nuestro color, por nuestro vestimenta, por nuestra manera de hablar y muchas de las veces porque no hablamos correctamente el español y mucho menos el inglés. Perdóname, Ángela, por tan larga.
No, Yoloxochilt, gracias por todo lo que has dicho. Es muy importante darle voz a eso y específicamente en una plataforma como esta. Dr. Morse, just in summary, because I think that I know that we're short on time, but I think it's important to highlight at least some of the points that Yoloxochilt mentioned. At least since the pandemic, the communities, the indigenous communities, due to fear, due to lack of knowledge around what is accessible to them in terms of healthcare access, used herbal medicine to take care of COVID-19 infections, for example, because they feared going to the hospital. They feared the high cost of a medical system. Additionally, there was also fear tactics for those that worked in certain industries, like in restaurants, either washing dishes or in spaces where the community takes care of other individuals, like daycare specifically. So this fear that impeded just the basic access to the services that are a given right to any individual, regardless of immigration status. And then finally, the abuse that they meet, either in lost wages, and employers not adhering to the appropriate safety measures, and exposing workers to chemicals that create ill health. And the final part is in terms of values. The value that is instilled in the communities is to respect the law in a foreign country like the United States. Unfortunately, that is not reciprocated. Our communities face extreme discrimination because of color, because of a limited language, either whether that is English or Spanish, because some of our communities do not also speak Spanish. and the discrimination that also comes from not being able to speak Spanish, but the language, the indigenous language. In summary, thank you.
Thank you so much, Yoloxochilt. And thank you, Angela, for translating. I can't tell you how important it is for us to hear your experience and hear your experience around justice for the communities that you represent and have served as an organizer and translator and in many other roles for. So thank you for your courage in describing what I know has been a very painful experience. And also thank you for just being so clear and direct about what is actually happening and what is actually lacking in terms of response and access and translation interpretation, amongst other things, including safety and safety for workers across sectors. So thank you again for that. I am going to try one more time with Sheldon. Sheldon, let's see if we can hear you this time. Any luck?
Can you hear me?
All right. Yes. Beautiful.
Sheldon imachiapi hojo yanke lakota oyate matangelo. Greetings, everyone. My name is Sheldon Raymore. I come from the Cheyenne River Sioux tribe. We're located in South Dakota, but I've been in New York for over 10 years, so I'm considered a New Yorker. A lot of what I do is cultural health, and that involves the language. I think it's super important that we incorporate language into this discussion today, which sounds like everyone has kind of contributed to that. And a lot of what I do is, I think when we think about performance art, relates to mental health, self-esteem. Another part of this is access to care, because, you know, New York City being a hub of the performance art world, we get many Native folks that are students that come to New York City seeking services related to healthcare while they're, you know, continuing their education, but also performance artists who come to the city. You know, it's a tough city. It's a cutthroat world. And so folks oftentimes will need services related to healthcare. And I think really this comes back to folks that are maybe federally recognized, and it's about honoring the treaties that many nations have made with the United States. And so again, that relates to access to care and things that we would get on the reservation. We come to New York City. I've worked with the American Indian Community House as a health representative, and what our job was to really connect Indigenous folks to access to care, whether that be Medicare, Medicaid. So that's sort of my background, and all these elements are incorporated into the art or performance art world because, again, we are a transient city. Many Native nations and different people, Indigenous people, come to New York City to access different, you know, whether it be professions or whatever it is that they come to seek when they come to New York City. So that's been my experience that I would just like to share today. So thank you.
Thank you again for that, Sheldon. I'm so glad we're able to hear you. I'm so glad we got it worked out. And thank you again for describing so clearly and so eloquently the connection between performance art and public health and health equity and how you see these connections. So thank you for that. I'm going to pass the mic to my co-host, Angela Soto, for the next round of questions. So, and I did want to just underline and highlight as well my appreciation, Angela, for your support with translation, and also just remind the audience that we really had the honor of hearing two of our panelists, Yoloxochilt and Zenaida, speaking both Indigenous languages as well as Spanish throughout the conversation this evening. So over to you, Angela. Thank you.
Thank you so much, Dr. Morse, and thank you to everyone. And yes, we will take on the part 2 of this really important and much needed voicing of our communities, our Indigenous communities, our Native American communities in the United States. So before we get to the question that I know all of us are waiting for, of like the key question of how we reimagine public health, I want us to go back to something that Yoloxochilt touched on, is in addition to centering the history of Native Americans in this country and Indigenous populations throughout the Americas, how do we center and uphold our Indigenous healing practices in the midst of a pandemic specifically, but also our traditions pre, during this pandemic, and post, also knowing that we need, as a basic human right, healthcare access. La pregunta que hice es de que algo que tocaste, Yoloxochilt, sobre nuestras costumbres de remedios naturales. ¿Cómo mantenemos eso y cómo lo centramos como parte de nuestra identidad? No solamente en las comunidades indígenas a través de todas las Américas, pero también las comunidades americanas, nativoamericanas en este país de Estados Unidos, y cómo lo centramos no solamente como respuesta durante una pandemia, pero también antes de esta pandemia. Nosotros ya acostumbrábamos esas tradiciones durante la pandemia y después de la pandemia, reconociendo que a la misma vez nuestro derecho básico y principal como ser humano es acceso a la salud y a un tratamiento, como has dicho tú, los hospitales. So if I can maybe start with Sutton. Vamos a hacer la pregunta para todos y empezamos con Sutton.
Okay.
Sorry that I couldn't get off mute. Well, I think it first starts with really Western society seeing our traditions and our culture, our methodologies, if you will, as valid. Indigenous peoples are scientific. Our cultures and our traditions have carried us through colonization, has carried us through exploitation, catastrophic warfare, and biological warfare as well. And I think that is really the issue currently. And I think we're at this point where many talk about this prophecy of the condor and the eagle, right? I'm really looking at the condor as the heart and traditional knowledge, looking at the eagle as maybe Western society and more Western knowledge. And we're at this point where they're meeting, right? And I think that, we're at a point where we're seeing this paradigm shift, right, in public health, where our methodologies are now beginning to be centered, right? When we talk about holistic healthcare, when we talk about the interconnectedness, right, I think something that many Indigenous communities center is kinship, right? Looking at how the mind, body, and soul work with one another to really come to this harmonious place. And I think that with this shift that's happening, we need more Indigenous public health leaders. We need more Indigenous medicine people to use their voices and say, our ways are valid, our methodologies are valid. The way that we have been able to keep our traditions alive, our cultures intact, regardless of the pain that we have been subjected to. These methodologies of storytelling, the Western world would say, oh, that's qualitative practices, right? And I think, again, there needs to be respect from Western society, who has, demonized our practices. When we look at the American Indian Religious Freedom Act and the issues and the plight that we had to face as, Indigenous peoples within the United States to protect and honor our cultural ways. I think, again, it really takes serious dialogue like we're having now with you all about just the different organizations and Indigenous ways in which we all are strengthening our own resilience through our own ancestral practices and traditional ways. So again, I think a way in which we can continue to center culturally appropriate methodologies and resources are by lifting up the voices of Indigenous peoples and seeing us as experts, right? We have the solutions to support the healing of our communities. We have always had those answers, but no one was listening, right? And it's time that we, again, when we're talking about decolonization and we're talking about unbalanced power dynamics, it's about thinking about ways in which we can bring these voices, these leaders to these platforms and stand beside them when they bring solution-based approaches to public health issues we're seeing. And again, I just want to just really, again, emphasize how important it is to see Indigenous peoples as experts. And again, I think the only difference is a lot of times we lead with our hearts.
Thank you, Sutton. That was beautiful. You touched on many things. I really appreciated that in addition to centering just our historical struggles and the voices that we've been able to sustain through colonization and through so much discrimination, that you also focused on kinship and that you also focused on the storytelling piece of just our histories. And then maybe if we can also, I'd like to hear from everyone. This was actually a question that I merged together that came from our audience. And so thank you, but really led by what Yoloxochilt mentioned. If we can go to Ben, would you like to offer?
Yeah, I think, Sutton, but, a lot of, I identify with a lot of the, discussions that we're having around diversity of ourselves. White supremacy is real. There's no doubt about it. And we all pay the price of living in this society that degrades us as people of color, as people with traditional beliefs, as people with, this resiliency of land ownership and protectors of the natural world, seen and unseen, that spiritual element. So I think that, it's often a balance of like fighting the white supremacy or nurturing ourselves, and it's like it has a cost. And so I'm often trying to redirect people back to our roots of let's burn sage, let's give tobacco, let's make a drum, let's sing a song, let's pray tawochikie, let's talk in our native language. And these things are probably the most in line with what our ancestral communities would identify as being very important, and, this other drive, you must be socially economic, success. You must be, this person that is modern or, without a community, without a mother, a grandmother, a uncle. Sheldon and I come from a community where there are like 40 people in a house. And they're all related and everybody's taking care of each other. And that's not the Western model of being American, And so I think that whatever we can do to be introspective about the diversity of our traditions is really important. And some nations were completely, suppressed, and now they're reconstituting traditions that were forbidden by the church or by the government, There's a story of my grandmother digging up tumsala on our reservation, and that's the wild turnip. It grows like in the prairie, and you have to dig it out with the stick. And how they saw this car driving to them, and this was in the 40s, and it was a sheriff, and he came out because he heard they were doing a ghost dance. And so it's not this historical mythical past. It's been a very present thing where there's a prohibition on our spirituality and our practices. And, it was kind of like a ha-ha story. But of course, as the generations now are becoming more woke, we understand what this was, this very high level, prohibition of existence. And so we must counter that by coming together in forums like these. And the research methodologies in academia that are espoused by Indigenous researchers are also telling us, use your language, use your constructs, use your community as valid sources of information, and not just the CDC or the census. And that's a crisis. We're not represented in the West, and so therefore we're invisible, and we're continually having to introduce ourselves, and that's because they don't recognize their responsibility to include us because we're different, and that's a very central crisis in public health. We talked with Seattle Indian Health Board about this, convening epidemiological meeting that can help us get these state, city, county communities together to really say, how can we be responsive to Indigenous people demand for representation? Because that also drives funding, and then it's just perception that there's no need, so there's no resources allocated. So it's a very dangerous environment for us, and I'm always happy to see the diversity of leaders and advocates. So thank you.
Thank you, Ben. I like the way you recontextualized the word prohibition. I know that we often hear prohibition in other contexts and not in the way that you used it. And the part around storytelling and being able to tell our histories through that, but also using that almost like a messaging tool. I know that one of the ways early on during the peak of the pandemic, when we were trying to draw attention to the high rates of mortality among our older adults, right? And the way to adhere to, like, let's say the preventive measures was to say, look, the people that we are losing is the connection to a past that once they are gone, our histories are also gone. And sometimes in the presentations that we were conducting, that was that moment that kind of, sometimes I felt like there was a change in the room to say, we need to act, and we need to act now. Whether it was to use the preventive measures of, covering, using the mask, washing our hands, and even now with the COVID-19 vaccine, right? How do we what tools do we have in our hands so that we can keep our elders here? And I know that we're running short on time, but I do want to get everybody's opinion and voice around how do we center our histories, especially around natural medicine and our practices, also in the face of a pandemic. If we can go to Sheldon, and then we'll go to Yoloxochilt and Zenaida.
Sure. Can you hear me?
Yes.
Seems to have been my problem this whole time. I'm sorry about that. But one thing that was really interesting that stood out to me is I have a relative who's a nurse and worked up in North Dakota. And they talked about when COVID sort of came upon us, that there was a spirit of COVID that had come into they actually saw the spirit of COVID. And I've heard this from many different Indigenous people about the spirit of COVID and like the spirit of sickness, and how that's prevalent, has always been prevalent among our Indigenous nations, many different nations. When smallpox came into the picture, and different cholera and things like that, we always documented those things, and we always sort of acknowledged it as a spirit of sickness. So I think it was really interesting for this relative of mine in modern day times to say they actually saw this spirit that came into the room, and a patient became actually sick with COVID. So I think that a lot of times we might think of these indigenous beliefs or indigenous ways as maybe fantasy or mythological or legends or whatever, but they really do have a spiritual impact, and there still is a belief that's strong there, even in today's world. And I think it's important that we acknowledge that. Oftentimes that gets pushed to the side, and I think that that's more of a Western way of sort of diminishing our indigenous beliefs or maybe colonizing us. And so I think it's important that we acknowledge that there are more than one way of doing things. Just because these colonizers have come to our territorial areas and sort of have taken over, it does not relinquish or diminish any of our indigenous beliefs. So that's something I'd like to sort of leave you with today. So thank you.
Thank you, Sheldon. That was beautiful. I don't think that I would be able to recapture that, so I will hold it as you stated it. Yoloxochilt y Zenaida, la pregunta sobre cómo centramos nuestras tradiciones durante una pandemia, nuestras tradiciones de remedios, y a la misma vez reconociendo de que aunque tengamos limitaciones en acceso de una salud justa y acceso a servicios justos, de cómo aún así mantenemos nuestras tradiciones a la misma vez que tenemos que también acceder los recursos y los servicios como medicamentos, vacunas, etc.
Yo creo que, por ejemplo, lo que es medicina natural es como nosotros nos han enseñado a los ancestros, nuestros abuelos, que de donde venimos. Claro que siempre lo tenemos aquí, lo hacemos de muchas maneras. Por ejemplo, todas las hierbas, todas las plantas medicinales que nos han enseñado nuestros abuelos, tenemos un lugar especialmente a donde nos llega eso cuando las plantas de nuestro pueblo, ahí lo ponen a secar a nuestras madres y lo mandamos a traer, y eso fue que pasó en el tiempo de pandemia. Quizás no todos estábamos preparados para recibir eso, porque de un momento a otro tampoco no sabíamos qué tanto era los síntomas que trae el COVID. Entonces, todo de lo que habíamos hecho, todo lo que nos enseñaron, a pesar de que sí tenemos en cierto acceso a las medicinas, pero muchos prefieren conservar esas tradiciones, conservar y no perder en eso. ¿Por qué? Porque muchos sintieron que les ayudó a más en medicinas naturales, que hierbas naturales, que el medicamento que los recetaban en el hospital. Mucho por miedo, porque la mayor parte de los pueblos indígenas no están acostumbrados de ir a los hospitales por cualquier síntoma que sienten. Siempre prefieren curarse con sus propios remedios. Y eso también fue que pasó aquí, aunque van por muchas de las veces por la forma como los atienden, las atienden, aunque sabemos que dicen que sí hay acceso al hospital, vamos, pero la triste realidad es que sufren mucho lo que es la discriminación al llegar ahí por sus rasgos, cómo nos miramos. Entonces, esos son los tratos que la mayor parte que pasa. Quizás nosotras las mujeres nos embarazamos, vamos, pero tenemos que ir porque también a veces nos basamos bajo la ley, que si no podemos, quisiéramos a veces, muchos de las veces quisiéramos tener nuestros hijos en la casa como estamos acostumbrados de tener nuestros hijos en nuestra casa, pero tenemos que ir bajo la ley también. Pues son muchos desafíos que están enfrentando también. Y sí, tenemos a veces por miedo también, porque realmente muchos van a un chequeos o cualquier chequeos que hacen a los hospitales, les llegan los biles de 3,000, de 4,000, y entonces para nosotros, ya que somos de nuestro origen, para nosotros se nos hace mucho de ese dinero, por no tener Medicaid. Y entonces esos también son varios los temores que tenemos como pueblos o como personas que trabajamos. Y si vamos a pagar esa cantidad de nuestra salud, es como que estaríamos trabajando 2-3 meses de un trabajo. Bueno,
Gracias,
no sé si
Zenaida.
respondí bien la pregunta. Gracias.
Sí, gracias. Tocaste en todos los puntos que muchas de las veces impiden a nuestras comunidades llegar a un acceso médico y a la misma vez a lo que le tenemos mucho más confianza, y es lo que conocemos, y nosotros conocemos nuestros remedios. Y para nosotros que trabajamos en salud pública es conocer eso para a la misma vez levantar ese conocimiento y también usarlo como decir, no tienes que dejar el remedio o lo que ya conoces, pero también es importante tomar todo este remedio y saber o tomar este medicamento, por ejemplo. Pero lo más importante es reconocer de dónde llegamos y qué es lo que nosotros valoramos. Eso es importante. Yoloxochilt, si tú también puedes responder a la pregunta.
Pues todo lo que mencionó la compañera Zenaida es lo que también en mi comunidad ha surgido. Muchas de las veces yo recuerdo que en mi niñez, desde ahí es donde se nos enseña, donde nosotros aprendemos todo lo que es acerca de la manera en la que nos tenemos que curar en nuestra comunidad. Recuerdo que había una hierba que era para comer, que se le conoce como quelite, pues eso a veces nuestros abuelitos lo hervían y nos lo daban para poder consumirlo, y ellos decían que eso de manera que estuviera caliente, pues nos ayudaba a expulsar las flemas. Me tocó también en una ocasión estar en mi comunidad donde llegaron personas blancas, donde estuvieron viviendo durante, no recuerdo bien si 2 años, donde ellos aprendían de nuestra gente, qué era, para qué servía cada planta. Ellos fueron a aprender en nuestra comunidad, y mucha de la gente por su necesidad se acercaban a ellos y les decían, no, pues tú traes otra medicina aparte de la que nosotros conocemos. Entonces en ese tiempo intercambiaban medicinas en la comunidad. Los blancos le daban la medicina a ellos y ellos le enseñaban a ellos para qué servía cada planta que había en la comunidad. Me tocó escuchar y ver todo eso, porque yo entendía un poco español y hablaba también un poco mi lengua. Entonces de algunas de las veces me tocaba interpretar entre esos diálogos que habían a veces entre mi abuela y las personas que estaban en esa comunidad. Entonces, desde niños, nosotros es que se nos enseña y se nos da la manera de poder sobrevivir de manera natural en nuestras comunidades, aunque algunas veces, pues sí, las dificultades porque no tienen un acceso a un médico es una cuestión también complicada en nuestra comunidad, al igual que en esta parte, porque muchos tienen miedo porque al llegar al hospital ellos piensan que o se han acercado, y ese mensaje de las personas que se han acercado ha sido de discriminación, de no comprenderlos y de atenderlos de mala manera, e inclusive ellos se sienten ofendidos al estar ahí. Entonces esa ha sido una de las cuestiones y el costo más que nada por las cuales nuestra gente a veces no se acerca, y durante en este tiempo complicado que estuvimos, de lo cual estamos mencionando, pues nosotros de manera comunitaria nos organizamos de este lado aquí en la ciudad de Nueva York, con ayuda de algunos talleres que recibimos por parte del Departamento de la Salud. Recibimos un taller con Melissa, una nativa. Ella nos enseñó a hacer corte y todo esto. Y en ese tiempo que aprendimos eso durante la pandemia nos sirvió, porque a base de ese conocimiento que se nos dio con coser con máquina, nosotros estuvimos elaborando mascarillas para nuestra comunidad, repartiendo la mascarilla a la gente que no la tenía, porque era de muy difícil acceso, no había, y este conocimiento que nos dieron pues nos ayudó mucho durante la pandemia. Nosotros estuvimos un rato fuera del departamento pidiendo que se nos volvieran a dar esta oportunidad de recibir estos tipos de talleres también, porque era de alguna manera muy beneficioso para nuestra comunidad, y al parecer no desconocemos por qué fue que ya no se nos dieron esa continuidad, ya no había ese aporte por parte creo que ya no habían recursos, no recuerdo bien qué fue lo que ocurrió, pero realmente hay cosas que entre las dos, entre nuestra comunidad y la medicina occidental, y las cosas que se nos enseñan, nos ayudan a que nuestra comunidad vaya haciendo este enlace de poder convivir, porque no todos, tampoco las personas blancas son malas, ni todas las personas hispanas son buenas, y no todos los que vienen son buenos. Entonces es un equilibrio que se busca vivir aquí, y realmente es muy, muy bueno poder aprender de todo un poco, y sobre todo recibir esta oportunidad de compartirlo. Gracias.
Gracias. Gracias, Yoloxochilt. We're coming to the end. We have just 2 more minutes left, and I can't allow us to leave without sharing how do we reimagine public health. So if you can capture that, and I know it's impossible, but if you can capture that in one word or one phrase, please, if you can do it. Yo sé que ya llegamos al fin de nuestro programa, de nuestra programación, pero no puedo dejar el foro sin hacer esta pregunta. ¿Cómo reimaginamos nuestra salud pública? Si pueden hacerlo, si lo puede captar con una palabra o una frase. Empezamos con Sheldon. Sheldon, we'll start with you. What one word or one phrase that you can say, how do we reimagine public health?
I would say decolonize. Maybe is a good word.
Perfect. Thank you. Sheldon, pick who goes next.
Of course, Ben. Geboe.
I would say stay encouraged above all. And I pick Zenaida.
Thank you. Zenaida, le toca a usted. ¿Qué frase o qué palabra para reimaginar la salud pública?
Que la salud pública tenga acceso para toda la raza, no importa el color y el color y la raza. Ay, perdón.
Gracias, Zenaida. ¿A quién escoge usted, Zenaida?
Yoloxochilt.
Yoloxochilt.
Pues de que sí se puede, si todos trabajamos y colaboramos para poder lograrlo.
Gracias. And Sutton, you have the last.
Well, Sheldon said decolonize, so I'm going to go with indigenize.
Love it. Thank you so much. Thank you, everyone, for this wonderful opportunity. I'm so privileged. Thank you.
Thank you so much, Angela. Thank you to all of the panelists. Oh, how beautiful. It's so hard to close out this conversation. And I can't tell you how much I appreciate the words and just the opportunity to be in dialogue this evening. I want to make sure Angela has the last word to close us out, but I just wanted to share a few final reflections as we close out the evening. I just wanted to remind us of a couple of the words that really came up throughout the past hour and a half that we've been in conversation together. I want to underline what Sutton said about what does safe look like and how important kinship is in shared struggle and in moving forward. I want to underline again what Ben said about how we can reverse invisibility and how we can honor historical practices. Sheldon talked about mental health and self-esteem and all of those as parts of the beauty and power of performative arts and multidisciplinary artwork. Zenaida spoke about advocacy and care and workers' rights. I heard Yoloxochilt speak about fighting against lost wages, centering Indigenous languages, not just Spanish, and again, reflecting on how we can learn from the power of Indigenous healing and Indigenous medicine. And I heard Angela speak so beautifully and ask such an important question for the conversation this evening, again, about how we can revisit and learn from Indigenous health and Indigenous medicine and Indigenous healing practices. I want to just share a couple of phrases before I pass the mic to Angela to truly close us out. I just want to read a few of the sentences from the resolution that the Board of Health passed just a few days ago. And I think it's maybe helpful and maybe appropriate for this particular conversation, because I think it does get at the heart of what all of you shared today. In the resolution the Board of Health passed, it says, whereas settler colonialism, Indigenous genocide, and enslavement of Africans are part of the history of our nation, and whereas the city of New York is situated on Lenape, Rockaway, and Canarsie land, and whereas these original injustices have been without comprehensive restitution or redress, whereas the work of undoing racism is grounded in love as well as science and civic duty. This love is not sentimental, rather it is what James Baldwin called the tough and universal sense of quest and daring and growth. And there are many more words in the resolution, but those feel particularly important to share for this evening. So I'll pass it over to Angela to close us out.
Thank you, Dr. Morse. And it's so, I would hate to close on such a beautiful ending in what you read to us. And nevertheless, I need to just thank everyone for this opportunity. I want to remind all of us that the events from these series are available for viewing in New York City Department of Health's YouTube and Facebook page. Please stay tuned for more on these series or similar series. And then thank you everyone for such a wonderful evening. I would not spend it anywhere but with you. Thank you for everything that you shared. Good night.
Thank you.
Thank you.